Insulin therapy is a cornerstone in the management of diabetes, especially for those with type 1 diabetes and advanced type 2 diabetes. The effectiveness of insulin depends not only on the type and dose, but also on how and where it is administered. In this video, we'll explore the importance of choosing the right injection sites and rotating them systematically. By understanding these principles, patients can achieve better blood sugar control, minimize complications, and improve comfort and adherence to their treatment. Let's begin by understanding why proper injection technique matters for everyone using insulin. Site where insulin is injected plays a crucial role in how quickly and effectively the medication is absorbed. Different areas of the body have varying rates of absorption, which can impact blood sugar control. Consistency in site selection and proper rotation can help ensure predictable insulin action. This is especially important for maintaining stable glucose levels and preventing unexpected highs or lows. Let's take a closer look at why rotating injection sites is so important for long-term diabetes management. Rotating injection sites means systematically moving the location of each injection within the same anatomical region. This practice helps prevent tissue damage and ensures that insulin is absorbed consistently. Without proper rotation, repeated injections in the same spot can lead to complications such as lipohypertrophy, fatty lumps under the skin, or lipotrophy, which is the loss of fat tissue. Both conditions can cause erratic insulin absorption, making blood sugar control more difficult and unpredictable. When injections are repeatedly given in the same area, the risk of developing localized complications increases. Lipohypertrophy or fatty lumps can form, making the skin uneven and sometimes painful. Lipotrophy, on the other hand, results in fat loss, creating pits or indentations. These changes not only affect appearance but also interfere with insulin absorption, leading to unpredictable blood sugar levels. Patients may experience unexplained hypoglycemia or hyperglycemia, making diabetes management more challenging. Let's look at the main anatomical regions recommended for insulin injections. The most commonly used sites include the abdomen, thigh, upper arm, and buttocks or hip. Each area has its own absorption characteristics and suitability for different types of insulin. Understanding these differences can help patients choose the best site for each injection, optimizing their therapy and minimizing complications. Abdomen is often the preferred site for insulin injections. The area between the lower ribs and the pubic region, avoiding a 2 cm radius around the navel, provides the most consistent and rapid absorption. This makes it ideal for rapid-acting and short-acting insulins, especially those taken at mealtimes. Patients should rotate injections within this area to prevent tissue changes and maintain effective absorption. Thigh, specifically the upper outer or anterolateral aspect, is another recommended site for insulin injections. Absorption here is slower compared to the abdomen, making it suitable for intermediate or long-acting insulins, often referred to as basal insulin. Rotating injections within the thigh region helps prevent complications and ensures steady absorption over time. Upper arm, particularly the posterolateral aspect, offers a moderate rate of insulin absorption. This site may require assistance for some patients, especially those with limited mobility or dexterity. It's important to rotate injections within the upper arm to avoid tissue changes and maintain consistent insulin action. Buttocks or hip region is characterized by the slowest absorption of insulin. This makes it a preferred site for long-acting insulins, which are designed to provide a steady release over an extended period. As with other sites, rotating injections within this area is essential to prevent complications and ensure effective insulin delivery. Each injection site offers a different absorption rate. The abdomen provides the fastest and most consistent absorption, making it ideal for rapid-acting insulin. The thigh and upper arm offer moderate to slow absorption, while the buttocks or hip are best for long-acting insulin due to their slowest absorption rate. Understanding these differences helps patients match the right insulin type to the most appropriate site. Systematic rotation involves moving the injection site within the same anatomical region before switching to another area. For example, within the abdomen, injections can be spaced at least 1 finger width apart, moving in a circular pattern. This approach helps prevent tissue damage and ensures that no single area is overused. Consistent rotation is key to maintaining healthy skin and effective insulin absorption. Visual guide can be helpful for patients learning to rotate their injection sites. Diagrams often show how to move injections in a systematic pattern within each region, such as the abdomen or thigh. By following a rotation plan, patients can avoid injecting into the same spot repeatedly, reducing the risk of complications and ensuring optimal insulin effectiveness. Lipohypertrophy is a localized thickening or swelling of fatty tissue that occurs due to repeated insulin injections in the same spot. This condition can make the skin feel rubbery or lumpy and may be visible or palpable. Lipohypertrophy not only affects the appearance of the skin, but also interferes with insulin absorption, leading to unpredictable blood sugar levels and increased insulin requirements. Presence of lipohypertrophy can delay insulin absorption, making it difficult to predict how quickly the medication will work. This unpredictability can result in higher insulin doses being needed to achieve the same effect, and may also increase the risk of both high and low blood sugar episodes. Regular inspection and palpation of injection sites can help detect early signs of lipohypertrophy, allowing for timely intervention. Using the right needle length and injection angle is important for effective insulin delivery. Shorter needles, such as form, are typically used at a 90-degree angle and usually do not require a skin fold. Longer needles, like 5/6, may also be used at 90 degrees but sometimes need a skin fold. Needles 8 or longer are generally used at a 45-degree angle and require a skin fold to avoid injecting into muscle. Prevention of lipohypertrophy relies on proper site rotation, using single-use needles and regularly inspecting and palpating injection sites. Patients should avoid injecting into areas that are already thickened, lumpy, or have visible changes. Education on these preventive measures is crucial for maintaining healthy skin and ensuring effective insulin therapy. It's critical never to share insulin pens, cartridges, needles, or syringes with another person, even if the needle has been changed. Sharing these devices can transmit infections, including those that may not show symptoms. Each patient should have their own dedicated insulin delivery devices to ensure safety and prevent cross-contamination. Insulin is injected into the fatty layer just under the skin, known as the subcutaneous tissue. The most common sites are the upper arm, thigh, buttocks, and abdomen. Healthcare providers teach patients the correct technique, including how to prepare the skin, insert the needle, and dispose of used needles safely. Proper technique ensures the insulin is delivered where it's needed for optimal absorption. Before giving an insulin injection, it's important to wash your hands thoroughly. Prepare the insulin and check the solution for clarity. Do not use if it's cloudy, leaking, or contains particles. Make sure the injection site is clean and free from irritation, bruising, or scarring. These steps help prevent infection and ensure the medication is safe to use. Insulin should generally be taken about 30 minutes before meals, unless otherwise directed by your healthcare provider. This timing helps match the insulin's action with the rise in blood sugar that occurs after eating. Following your prescribed schedule is important for maintaining stable glucose levels and preventing both highs and lows. It's essential to move the injection site with each shot, even within the same anatomical region. For example, if you're using the abdomen, choose a different spot each time, spacing injections at least 1 finger width apart. This practice helps prevent tissue damage and maintains consistent insulin absorption over time. Never inject insulin into skin that is thickened, lumpy, bruised, red, scaly, hard, scarred, or has stretch marks. These areas may not absorb insulin properly and can increase the risk of complications. Always choose healthy, unblemished skin for each injection to ensure the best results. Before each injection, inspect the insulin solution carefully. Do not use the insulin if it appears cloudy, has changed color, is leaking, or contains particles. Using compromised insulin can affect its effectiveness and may pose health risks. Always use a fresh, clear solution for each injection. Used needles should be disposed of in a designated sharps container. Never reuse needles or other injection items. When the disposal box is full, follow local regulations for safe disposal. Proper needle disposal helps prevent accidental injuries and reduces the risk of infection for everyone in the household. Insulin therapy works best when combined with a healthy diet and regular exercise. Following the plan recommended by your healthcare provider helps maintain stable blood sugar levels and supports overall health. Be sure to know what to do if you eat less than usual or skip a meal, as this can affect your insulin needs. After each injection, remove the needle from the device and dispose of it properly. Never store your insulin pen or device with the needle attached, as this can lead to contamination or leakage. Always use a new needle for each injection to maintain sterility and effectiveness. Never transfer insulin from a pen to a syringe or mix different types of insulin unless specifically instructed by your healthcare provider. Mixing insulins or transferring them between devices can alter their effectiveness and increase the risk of dosing errors. Always use insulin as directed and in its original delivery device. Insulin should not be drawn into a syringe and stored for future use. This practice can compromise the sterility and effectiveness of the medication. Always use insulin directly from its original pen or vial, following the instructions provided by your healthcare team. Never mix insulin with other liquids unless specifically instructed by your healthcare provider. Mixing can change the properties of insulin and affect its absorption and effectiveness. Always follow your provider's instructions for preparing and administering insulin. If you are pregnant, planning to become pregnant, or breastfeeding, it's important to discuss your insulin therapy with your doctor. Your healthcare provider will help you weigh the benefits and risks to both you and your baby and may adjust your treatment plan as needed for optimal safety and effectiveness. Information in this video is based on the latest guidelines from leading organizations, including the American Diabetes Association, International Diabetes Federation, and recent clinical studies. Staying up to date with evidence-based recommendations ensures the best outcomes for patients using insulin therapy. Education is a vital part of successful insulin therapy. Patients should be taught proper injection techniques, site rotation, and how to recognize and prevent complications. Ongoing support from healthcare providers helps patients feel confident and empowered in managing their diabetes effectively. Let's review the main injection sites once more: the abdomen, thigh, upper arm, and buttocks or hip. Each site has its own advantages and is suitable for different types of insulin. Rotating within and between these sites is essential for maintaining healthy skin and effective therapy. A visual rotation pattern can help patients remember to move their injection sites systematically. Following a pattern, such as moving clockwise or using a grid, ensures that no single area is overused. This simple habit can make a big difference in preventing complications and maintaining effective insulin therapy. Regularly inspecting injection sites and avoiding areas with visible changes such as lumps or pits is crucial for preventing complications. Patients should be encouraged to report any changes to their healthcare provider and seek guidance if they notice anything unusual. Safe practices such as using a new needle for each injection, disposing of needles properly, and never sharing devices are essential for preventing infections and maintaining effective therapy. These habits should become a routine part of every patient's insulin management. Lipohypertrophy is a medical term describing the thickening of subcutaneous fat at insulin injection sites. It results from repeated injections in the same area and can significantly affect insulin absorption. Recognizing and preventing lipohypertrophy is a key part of effective diabetes management. Site rotation refers to the practice of changing the location of insulin injections within and between anatomical regions. This prevents overuse of any single area, reduces the risk of tissue damage, and ensures consistent insulin absorption. Mastering site rotation is essential for all patients on insulin therapy. A subcutaneous injection is an injection administered into the layer of fat and tissue just beneath the skin. This method allows for slow, steady absorption of insulin, making it the preferred route for most insulin therapies. Proper technique is crucial for effective delivery. Selecting the correct needle length and injection angle is important for delivering insulin into the subcutaneous tissue without reaching the muscle. Shorter needles are generally used at a 90-degree angle, while longer needles may require a 45-degree angle and a skin fold. Single-use needles are designed to be used once and then discarded. Reusing needles can increase the risk of infection, dull the needle, and cause tissue damage. Always use a new needle for each injection to ensure safety and comfort. Sharps disposal refers to the safe handling and discarding of used needles and other sharp medical instruments. Proper disposal prevents accidental injuries and reduces the risk of infection. Always use a designated sharps container and follow local guidelines for disposal. Glycemic control refers to the management of blood sugar levels within a target range. Proper insulin administration, including site rotation and technique, is essential for achieving optimal glycemic control and preventing both short and long-term complications of diabetes. Patient adherence means following the prescribed insulin regimen, including timing, technique, and site rotation. Good adherence leads to better outcomes, fewer complications, and improved quality of life for people living with diabetes. Summary: proper insulin injection technique and systematic site rotation are essential for effective diabetes management. By understanding the importance of site selection, rotation, and safe practices, patients can achieve better glycemic control, prevent complications, and improve their overall health. Remember to consult your healthcare provider for personalized advice and support on your insulin therapy journey.